Thank you for listening to this brief introduction to planetary health. We will begin with a few quick introductions. I'd like to start with my colleague, Hannah, if you wouldn't mind introducing yourself.
Good morning, good evening, good afternoon, everyone. I'm very excited about this. My name is Hannah Turley, and I'm the Partnership Coordinator at the Planetary Health Alliance.
Great. And Melvin, could you please introduce yourself?
Hi everyone, I'm Melvin Otieno from Kenya. I have a background in environmental health. I have worked closely with the Planetary Health Alliance since 2019 as a Planetary Health Campus Ambassador and a Next Generation Network Fellow. And I'm currently leading the Planetary Health Eastern Africa Hub. And I also work at the University of Eldoret as an assistant lecturer. Thank you.
Thank you. And I am Jessica Kronstadt. I'm the program director here at the Planetary Health Alliance. And we're also joined by Tamara Hayden, who's PHA's Senior Administrative Coordinator. So to begin, we are living in an extraordinary time. In the last several decades, humanity has made tremendous public health gains according to several traditional measures. For example, global child mortality has decreased from 225 deaths per 1,000 live births in 1950 to 37 deaths per 1,000 live births in 2022. Similarly, life expectancy has increased from 46 years in 1950 to 73.4 years in 2019. These changes are thanks to better public health interventions, new technologies, improved nutrition, education, and other factors. However, these gains in human health and the accompanying increase in human population, along with new and improved technologies, have also led to the Great Acceleration, where we see dramatic increases in use of freshwater resources, the number of motor vehicles, fertilizer consumption, production of paper and plastics, and primary energy use. All of these graphs show the scale of human consumption, and all reveal a similar, nearly exponential pattern over the last several decades. In that same time period, there's been a dramatic acceleration in the human impacts on natural systems. As these graphs show, the biodiversity and other natural systems we depend on are eroding at an alarming rate. As a few examples, to feed ourselves, we annually use about 40% of land surface for pastures and croplands. We use about half of the planet's accessible water, largely to irrigate our crops, and we exploit 90% of global fisheries at or beyond their maximum sustainable limits. In that process, we have cut down millions of square kilometers of the world's forests, and we've dammed over the majority of our rivers. Increasing global pollution is diminishing the quality of air, water, and land in many parts of the world. These and other processes are driving the sixth mass extinction, with roughly 1 million of the Earth's species facing extinction within decades. We can see our measurable impact on the Earth's natural systems. And while we have made vitally important health strides, our consumption patterns have, across the board, disrupted Earth's natural systems. Another way of putting this is that we live in an ecological paradox. The state of human health and that of our planet's natural systems have been trending in opposite directions.
This downward trend is highlighted by the crossing of planetary boundaries. The planetary boundaries concept presents a set of 9 planetary boundaries within which humanity can continue to develop and thrive for generations to come. Crossing these boundaries increases the risk of generating large-scale, abrupt, or irreversible environmental changes. 6 of the 9 planetary boundaries have been crossed as a result of human activity. We are currently experiencing a planetary emergency. It is climate change, and it is everything change. It is climate change, and it is everything change. And one more time, it is climate change, and it is everything change. These changes in our environment severely affect our health and jeopardize decades of public health gains in infectious and non-communicable diseases, malnutrition, mental health, and the impacts of displacement and conflict. Global environmental change has created a rise in cases of cardiovascular and respiratory diseases, infectious and diarrheal diseases, malnutrition, and mental health effects, to name a few. Environmental change can also cause displacement and migration, leading to civil strife and trauma. These changes in our environment exacerbate health challenges that disproportionately affect poor and marginalized countries and communities. Yet, the global north accounts for the vast majority of global carbon emissions, but are some of the least vulnerable to the environmental challenges that we are experiencing. These two maps highlight this inequity. The map on the left illustrates the countries of the highest annual carbon dioxide emissions per capita, while the map on the right illustrates the countries most vulnerable to climate change. Those who emit the least are the most vulnerable, have the fewest resources to adapt to climate change, and are those most likely to be displaced or forced to migrate.
Now let's revisit the ecological paradox. The fact is we have been borrowing against the health of future generations to realize economic and development gains in the present. Human health and well-being will trend downwards alongside ecological health and well-being. This begs the question, how do we balance the immediate needs of the current population with the need to preserve resources for the future generation? Planetary health is a solution-oriented transdisciplinary field and social movement focused on analyzing and addressing the impacts of human disruptions to the Earth's natural systems on human health and all life on Earth. A relatively young field that launched in 2015 with the Rockefeller Lancet Commission report, planetary health benefits from a long legacy and contribution from many other fields, including those of geosciences, global health, behavioral sciences, economics, and many others. Transdisciplinary in nature, planetary health weaves together information from all other fields to create a new conceptual, theoretical, and translational innovations that integrate and move beyond discipline-specific approaches to address a common problem. Planetary health encompasses a broad range of human-caused changes to Earth systems, including climate change, land use change, freshwater scarcity, pollution, biodiversity loss, among others. These ecological changes interact in complex ways to affect human health by increasing rates of infectious and non-communicable diseases, harming mental health and well-being, and also reducing access to nutrition and contributing to conflict, displacement, and trauma. For example, nutrition is negatively affected by the changing climate and limited availability of clean water and arable land, and loss of pollinators, and also marine degradation. Planetary health overlaps with other important movements, including the ones related to climate change and health and One Health. Climate change and health focuses on how the set of biophysical changes related to a changing climate, which have a broad range of health repercussions. And One Health, on the other hand, has traditionally focused on zoonotic diseases, one important component of infectious disease. One of the unique aspects of planetary health is that it looks across a broad array of human-caused biophysical changes, the full outer ring of the diagram, to develop a holistic understanding of the interconnectedness effects on health and well-being of humans and all. Given the shared commitment to addressing ecological determinants of health, each field brings important perspective and knowledge to our common challenges, and only by working together we'll be able to reach our aspirational goals. When you look at impacts of anthropogenic on human health, this final diagram illustrates the planetary health framework, and we find out that human activities are driving changes to Earth's natural system at unprecedented rates. These changes are driven by ecological, technological, consumption, demographic shifts that increase the use of resources globally. These drivers of change transform our natural system, changing fundamental conditions for human health and well-being. All of this is underpinned by societal value system confined in our social economic systems that drive change and worsen habitability of the Earth. These natural systems also change are taking place across the following Earth systems, and the disruptions to the global climate system, widespread pollution of air, water, and soils, rapid biodiversity loss, reconfiguration of biogeochemical cycles, including that of carbon, nitrogen, and phosphorus. Also pervasive changes in land use and also land cover, resource scarcity, including that of freshwater, arable land, and biophysical ocean changes, including increases in temperature and acidity of the oceans. These changes interact with each other in complex and sometimes uncertain ways, altering the quality of the air we breathe, the water we access, and the food we produce. Changing environmental conditions also alter our exposure to infectious diseases, harmful substances, and also natural hazards such as heat waves, droughts, floods, fires, and tropical storms. To understand how anthropogenic change to Earth's natural system affects human health, it is necessary to consider the context in which we live, including a focus on societal values, culture, governance, health, education systems, socioeconomic status, ethnicity, and race and gender. These changes in our planet and our lives affect every dimension of our health and well-being, including nutritional outcomes, infectious disease, non-communicable disease, displacement and conflict, and mental health outcomes. This planetary health framework provides us with a unified lens to see that all of our planetary health emergencies, whether they are driven by global pollution, land use change, or climate change, are linked together, intersect in complex ways, and revolve around social justice and human survival. We know the costs of action that are lower than the cost of inaction. We have many of the tools we need to respond to the planetary health emergencies, while other new tools, methodologies, and ways of relating to each other and the planet still need to be figured out.
With these tools, we can change our current trajectory. To do so and to achieve planetary health will require a great transition where we all learn to do nearly everything differently. This means changing how we produce and consume food, manufactured products and energy, how we construct and live in our cities, how we manage our natural landscapes and resources, and the stories we tell ourselves about our place in the world and our relationship to nature, what it means to live a good life. This great transition requires a multitude of solutions in every sector of life. Policymakers, businesses, educators, innovators, individuals, and communities all have a vital role to play. But as we think about these solutions, we must ensure that resources are allocated equitably among nations and within societies. In addressing these challenges and shaping a sustainable future, we must also recognize the power of collaboration. Collective action harnesses diverse perspectives, resources, and expertise to tackle complex issues that no single entity can solve alone. Together, we can envision a future where humans thrive in harmony with nature, where cities are designed for sustainability, and where there's room for the entire biosphere to flourish. As we navigate these challenges, let's rekindle our reverence for the natural world and recognize the intrinsic value of preserving life for future generations. It's time to reaffirm our collective values and ethics, guiding our decisions towards a more equitable and sustainable world. The future outcomes depend on the actions we take today. Let's act with urgency and determination to shape a better tomorrow for all and set examples for those who follow. Now we will play a short video that highlights planetary health, the urgency of now, and the hope for our future.
Planetary health is a very recently emerging field focused on understanding the human health implications of our rapid disruption and transformation of our planet's natural systems. We're really concerned that potentially the majority of the global burden of disease over the next century is going to result from our impacts across our planet's natural systems, from our disruption of the climate system, of global fisheries, of biodiversity loss, of accelerating scarcity of fresh water and arable land degradation, of changes in biogeochemical cycles, and that all of those transformations are accelerating at a pace that threatens every dimension of human health.
So we're downstream from the largest industrial project on the planet. So this is tar sands. It's not your sweet crude oil. It's more like peanut butter. And these projects aren't just threatening climate, they're threatening the survival of people. In this case, it's my people. When I saw what was happening in my territory, it's literally like seeing someone destroy a relative, because that is who I am.
So there's a massive, massive illegal logging going on. And, you know, when I first started, it was really easy to hate those loggers, but they just didn't have any choices. They were in these impossible situations where they had to choose between the well-being of their family and the well-being of the natural ecosystem. And they very, very clearly understood that if the forest was protected, it meant less disease for the community, and it meant more water for their rice fields, and then those rice fields were feeding their family. So they saw this as a really clear trade-off between short-term and long-term well-being.
I've started to wonder whether part of the predicament that we're in isn't a result of renouncing the authority of that awe and reverence that so many of us actually experience toward the natural world. I feel like we've gone pretty far away from that.
We need to change our spiritual identity. We need to provide ourselves with spiritual fuel so we can see the earth not just as something physical, but it has a spirit.
We somehow seem to have gotten away from talking about values and ethics, but it's something I believe we need to get back to. I think all of us are driven by our sense of values, but we don't talk about our collective shared values as much as we should.
The positive vision is right there for us to see. For my children and their children, it's easy for me to imagine a world in 100 years where human population has stabilized, where human populations continue to congregate in cities, but where those cities have been designed with intent and with thoughtfulness about how to minimize their inhabitants' ecological footprints and optimize their health and well-being. And it's quite easy to imagine a world in which with every passing decade after that, there is more room for the rest of the biosphere, not less. That to me is every bit as likely a future for my children's grandchildren as the catastrophic future. And the point is that it all depends on what we decide to do right now today. That's the urgency of now.
So, what has been done? In October 2021, the planetary health community published the Sao Paulo Declaration on Planetary Health. Published in The Lancet, the declaration includes concrete actions for 19 different stakeholder groups, such as cities and urban planners, governments, funders, media, and youth representatives. These actions support a more just and regenerative post-pandemic world. Currently, the Sao Paulo Declaration has over 300 signatories from more than 70 countries. The Sao Paulo Declaration is one example of the growth of planetary health. This timeline demonstrates the planetary health movement over time. Starting in 2017 with the inaugural meeting in Boston, Massachusetts, there have been 5 planetary health annual meetings. The 6th is being held in Kuala Lumpur, Malaysia next week, in 2 weeks, with the theme From Evidence to Action, Confronting Reality. This annual meeting is building on the Sao Paulo Declaration by creating a Kuala Lumpur call to action and a planetary health roadmap. To speak a little bit more about the Planetary Health Alliance. The Planetary Health Alliance is a diverse community of more than 3,000 individuals and 400 organizations from over 70 countries, committed to understanding and addressing the health impacts of global environmental change through community building, research, education, mainstreaming, and action. PHA's mission is to promote, mobilize, and lead an inclusive, transdisciplinary field of planetary health and its diverse science, stories, solutions, and communities to achieve the Great Transition, a comprehensive shift in how human beings interact with each other and nature. This map shows the 70 plus countries where PHA organizational members are and where this year's cohort of campus ambassadors are based. The gold countries with the slashes represent countries with both campus ambassadors and member organizations. In addition, PHA has 10 regional hubs that members may join to convene and coordinate efforts at a regional level. Thank you for your time. To learn more about the Planetary Health Alliance and our initiatives, please see our website at the link below.